Dr. Roger Stark is the Center for Healthcare's policy analyst. We were thrilled to have Roger, who's been on our advisory board for our Center for Healthcare, retired surgeon from Overlake Hospital, join our staff last year. So he's been one of our new additions to our staff, and he'll talk to you a little bit about healthcare reform. Dr. Stark.
Well, thanks very much, Dan. Paul thinks this is a lot of rules and regulations. He's never dealt with Medicare and Medicaid. This is like a universal prop tonight, too. There are two things I want to do this evening. First of all, I want to give you an update on what did or did not happen during the legislative session. That's number one. Number two is I want to tell you about our future projects and what we have going on here in the next 3 to 6 months. Now, you've all heard of the good, the bad, the ugly. Well, from a legislative healthcare standpoint this session, it was sort of the good, the bad, and the not so bad. So let's take a couple of those and look at each one of those areas. First of all, the good. There was a bill that we were involved with that deals with cost transparency, in the sense that patients can then go to providers and ask that provider what the actual cost of the treatment or what the cost of that procedure is going to be. We testified during the hearings on this bill, and it did pass. It was almost unanimous down in the legislature. We believe this is going to be one of the first steps to providing more consumerism, more patient control in healthcare. I think that was going to be a very important step in that direction. The other good thing that came out of this legislative session was sort of the negative deal. There were no new health insurance policy mandates. And as many of you are aware, Washington State has one of the highest required mandate provisions for each individual healthcare insurance policy sold in the state. We have at the present time 54. And research shows that each one of these mandates adds somewhere between 0.5% and 1% to the cost of a health insurance policy. And we have 54, so you can do the math on that. Fortunately, there were no new ones that were passed. There were some, one in particular we thought for sure was going to pass, and that dealt with autism and autistic children. It didn't. There were several others, but there were no new mandates. So 54 is the number, and we kind of lucked out. That was the good. And the bad, again, is sort of a negative thing. There were several bills that we testified and wrote legislative memos for. One dealt with insurance for 19 to 34-year-olds. And as many of you remember, 2 or 3 years ago, the governor had a Blue Ribbon Commission on health care. And one of the findings of that Blue Ribbon Commission was that the uninsured in this state, the majority of those uninsured were 19 to 34-year-olds. They were either still at home, or they were in college, or they were just starting out in jobs. And they were healthy. They felt they didn't need insurance. So what this bill provided was low-cost health insurance for the 19 to 34-year-olds. And the way that was supposed to work was it was going to either be mandate-free or mandate-light. Now, remember, each mandate is 0.5% to 1% of the cost of a healthcare policy. So these were going to be bare-bones policies. And again, this looked like one of the solutions for the uninsured. Unfortunately, it didn't even make it out of committee. So that was bad. The second bill that was bad was a bill that would have allowed the interstate commerce of health insurance. Now, Washington State has 54 mandates, so our premiums are up here. Idaho has 12 or 13, their premiums are here. Arizona has fewer than we do, so their premiums are down here. With the passage of interstate commerce, it would allow citizens, residents of Washington to purchase insurance in Idaho or in Arizona. Again, we thought that was an excellent bill. It was crafted by the Association of Washington Businesses. I sit on their healthcare committee and helped in the crafting of some of the language in that bill. Unfortunately, it did not make it out of committee either. So that was the bad. Now, the not so bad. Like you've heard from the other speakers here this evening, the other center directors, because of the budget shortfall, we sort of dodged a number of bullets in this legislative session. And one of the big ones was massive healthcare reform. And the bill came about by it being pushed by the majority healthcare leader in the Senate. Very powerful individual, and yet the bill, as it was passed, became very watered down. This bill would have increased employment taxes by 7%. It would have cost somewhere in the neighborhood of $15 billion. It would have been a top-down, centrally planned, state-run, basically universal mandatory health program for every citizen of the state. As I say, that's the way it started. It went back and forth from the Senate to the House, Senate to the House. By the time it hit the governor's desk on Monday, it was massively watered down. And one of the critical features in the bill Monday was it provided for yet another health policy study group over the next 6 months. Now, we've already had 17 or 18 health study groups in the last 3 or 4 years. So what we didn't need was another one, and the governor realized that, did not have any money for it, and took that out of the bill. So as the bill is passed, there's language in the bill that requires, theoretically requires the state to have some kind of a universal health care program by 2014. There's no funding mechanism, there are no details. It's just a statement that's in that bill. There's some peripheral things in there with an expansion of Medicaid and some things like that. But basically what the bill does is it sets the state of Washington up to be able to interface with any health care reform that comes out of Washington, D.C. in the next 4 to 6 months. And I firmly believe that we are going to see something out of Washington, D.C. by the end of the summer. And it's kind of like the famous baseball player Yogi Berra said, when you come to a fork in the road, take it. And that's where we are. We're at a fork in the road here with healthcare right now. And we can go in a couple different directions. And I will be honest with you, I am very concerned about the way the federal government is moving on healthcare. Anyway, that was what happened at the state level in the state session. So it was bad news, good news, and not so bad news if you want. Second thing I want to talk about were some of the projects that we have going on. Dan mentioned the big one that's coming up in 2 weeks, which is our 7th annual healthcare conference. We're anticipating well over 300 attendees. It features 3 panels in the morning and then a luncheon speaker. And those panels will be a legislative review with Representative Cody, Representative Erickson, and Steve Hill from the governor's office. And that panel will be moderated by Alan Schaffler from the King 5. Then the second panel I'm really excited about. It'll be new trends in healthcare. And some of these you've heard about, like medical home, like wellness programs, like patient-directed care, concierge type of medicine. And fourthly, we'll have an expert on evidence-based medicine and whether that's good or bad or what the decision is on that. The third panel then we're going to deal with the uninsured and the insured. And we have an expert coming out talking about who these 45 million uninsured people really are. And are these 45 million destitute, down and out folks, or are there other kinds of demographic groups in that 45 million? And then the second part of that is the insured, and yours truly will be giving an update on health savings accounts, which look very, very attractive as a means to getting more patient direction, more patient focus, and more patient control over their healthcare policy and healthcare dollars. Also, one last thing, just this week we received a $50,000 grant to be proactive towards what's happening at the federal level. And as I mentioned before, the state is treading water right now. They're waiting to see what happens at the federal level. So although we are a state-based think tank, and the other center directors deal exclusively with state issues, because of the nature of healthcare, probably 75, 80+% of my time is also examining federal issues with some overlap, like in Medicaid and so forth, Medicare. Anyway, with this $50,000 grant, we're going to write op-eds. We've already had one published Monday in the Seattle Times. It will run in the Washington, D.C. Examiner sometime this week. We will do media interviews, radio, television. We will hold conferences and things like that. So this is going to be a big promotion, and it's going to be a big focus of our healthcare center, at least over the next 3 to 6 months. Thank you very much, and I'd be happy to answer questions afterwards as well.